What I am most proud of is that this organization is still carrying out the mission of our founders. In 1990, a group of courageous women came together because they saw a need to address the lack of research on women and women's health. To this day, we are moving that vision forward, but in an even broader way. We're educating the public. We are driving multiple priorities with policymakers. We are seeing a lot of people much more aware of women's health research and the need to specifically focus on it. We are seeing this at the federal level, and I am so proud that this organization, over the course of our 3.5 decades, has worked consistently in a bipartisan way with all different policymakers to educate and help move towards solutions.
I think another example that I'm so proud to have seen SWHR play a really leading role is the work that they've done across immunology, from fact sheets and policy playbooks for alopecia areata, for rheumatology, for psoriatic arthritis. Again, these are conditions that disproportionately impact women. Those have really driven the policy conversation around improving women's health and immunology. And then I'd probably be remiss if I didn't mention something in Alzheimer's disease, the fantastic policy agenda that SWHR created about 2 years ago. But one of the things I've been really excited to see move forward is the work that they're doing to help educate the policymaker community and the scientific community on diagnosis of Alzheimer's disease in the community. The combination of webinars, of policy resources, have really helped to advance the understanding of the importance of a timely and accurate diagnosis and the things that we have to keep in mind about diagnosing Alzheimer's disease, particularly among women.
In the context of women's heart health, we see the society as a really key partner in amplifying the work that we do, but also in reminding us not just about the need for better representation and sort of just playing more research in women's heart health. But I would dare say kind of the injustices that exist in the current landscape of women's heart health in terms of access, treatments, diagnostic journeys, etc. The society continues to be a real, I would say, important catalyst for the work that WomenHeart has been trying to do.
The society has also played a key role in destigmatizing topics like menopause and the importance of midlife health of women. That plays a critical role in changing the discourse because there are things we don't talk about. We used to not talk about breast cancer 40 years ago. Now it's not a big deal. We're still hesitant in some quarters to talk about menopause. It's just a natural phase of a woman's life, and it's an important one that marks a juncture where new symptoms can occur, and importantly, the onset of chronic conditions can really pick up at that time point, which means it's a critical health inflection point where we could actually intervene and prevent or delay the development of chronic disease. So we have to talk about it. And the society has done a great job in elevating and destigmatizing topics like menopause.
The most important thing I think that we've done is be established. So, in 1990, when we were founded, it was really on the idea that women were not being included in clinical trials, that women were considered just little men, and so you could extrapolate that data out. We know that's not true. But it did take a lot of time, and in fact, we're still fighting that issue. And then I think the biggest accomplishment for us, truly an emphasis on women's health research being a national priority in the United States. At all levels of government, at the congressional level, within private industry, within investors who are looking for women's health to invest in, companies, I think it's really, truly coming together in a meaningful way to actually make this a priority and to make sure that the gender health gap is being closed through these efforts.